One man with a deadly blood cancer running out of time.
If they don't find a donor, then, it's pretty much over.
Another man facing the same stark reality.
I had no idea, no concept of what cancer is. And I remember saying to my mom, I'm gonna die, I'm gonna die, I'm gonna die.
We hear a lot today about breast cancer, about colon and prostate cancer, but there are other kinds of cancer just as devastating, just as lethal. These are cancers of the blood, including leukemia, lymphoma, and multiple myeloma. Tonight we follow the ferocious struggle of two people against the most lethal of enemies, and the medical miracles, caring attention, and sheer will that help them live. Tonight on Temple Lifelines, we'll explore a powerful technique for treating, often curing patients with these blood cancers. A technique that replaces diseased cells with healthy ones. It's called bone marrow transplant, and it has given hope where there was none. Frank Ryan was a Philadelphia police officer for 20 years. Just after he retired, his father developed prostate cancer, and Frank goes from being a cop to being a nurse to his dying father.
Towards the end of his life, he asked me when's the last time I got a physical. And actually, men, they don't like to get physicals or see doctors or anything.
In fact, it had been 20 years since Frank's last physical, so he makes a promise to his father, and soon after his father dies, he keeps it.
I went to my doctor, and she did some blood work on me, and she said, there's something wrong with your blood.
The grim diagnosis, an advanced stage of non-Hodgkin's lymphoma, an increasingly common cancer that affects more than 61,000 Americans each year.
I was afraid. It's a human condition, and if you're not afraid, then you're crazy.
And so begins what turns into a long, exhausting battle. Doctors trying regimen after regimen of the most potent chemotherapies to kill the cancer cells. For much of the time, Frank feels sick.
The only thing you can do is fight. Who wants to give up? You just got to get tough because, your cure could be right around the corner.
1,500 miles away in Dallas, Texas, Deidre by Harry's husband Stan is fighting lymphoma, the same disease Frank has. Physicians at Baylor University Medical Center put Stan on the bone marrow transplant list, and the search begins for a donor. Deidre is frantic.
We were down to the wire. Stan was not going to survive, and he had to have a transplant. And I hoped against hope that I might be a match for him. The chances were slim to begin with, and I was not a match.
Finally, a match is found for Stan through the National Marrow Donor Registry, a databank of 7 million people who, with a simple blood test, have registered as potential donors. But it's too late. Just 4 days after a donor is found, Stan dies. Deidre mourns deeply and gives no more thought to the registry for years. Frank's chemotherapy treatments continue, following a painful pattern. Each works for a time, but then the cancer comes roaring back. The cycle repeats itself for 8 long years. Since his bone marrow has been destroyed by cancer and by the powerful chemotherapy treatments used to fight it, Frank has only one option left: a bone marrow transplant.
If I was going to go down fighting, I wanted to go down fighting with the best.
The Fox Chase Temple Bone Marrow Transplant Program is a joint commitment by Temple University Health System and Fox Chase Cancer Center to work together to strengthen cancer care in our region. The program is located on the campus that Temple's Jeans Hospital shares with Fox Chase in Northeast Philadelphia. Its doctors have performed more than 700 bone marrow transplants in a program known for treating the whole person, not just the disease.
I feel very strongly that we have to address the emotional needs of the patients and their families.
Review your records.
We have to find a way to explain a very difficult process and procedure. And we have to find a way to make them comfortable through this.
With the advances in the treatment of blood cancers, the most common kind of transplant now is one in which doctors replace not the marrow itself, but the blood-forming stem cells. And let's be clear, these blood-forming stem cells are not the embryonic stem cells that grow into any type of cells, the subject of such controversy today.
The stem cells that we deal with in our program are mature adult stem cells as found in the bone marrow of adult, or in some cases, children, but not newborn babies, not fetuses.
Low intensity mini regimen.
The clinical team discusses Frank's options.
I would vote to go for it. Then we should do it.
And agrees that a donor transplant rather than a self-transplant will give Frank the best chance of survival.
I may last another year, year and a half on the chemo. Then I got zero chance, and I'm ready to go for it.
The search begins to find a healthy donor. Frank's brothers and sisters are tested. None is a match. Coordinator Chris Miller scours the donor registry.
Unfortunately, I do not always find a match for the donors I search for, and that's really hard because these are people who need the shot.
A special passion drives Chris's search.
I had a brother, Michael, who had leukemia, and he needed a transplant. I was the only match. I became his donor. Even though he eventually relapsed and died, when I went into nursing, I chose oncology, so I could help other people like him.
You know, your life is in the balance. If they don't find a donor, this is why donors are so important. If they don't find a donor, then, you know, it's pretty much over.
Is there a donor on the registry who will be a good match for Frank? And can that donor be found in time? We'll find out when we return. Stay with us.
For more information about the Fox Chase Temple Bone Marrow Transplant Program, please call 1-800-TEMPLE-MED.
Chris searches the marrow donor registry, trying to find a match for Frank. After 8 years of battling non-Hodgkin's lymphoma with chemotherapy, Frank's only hope of survival is a bone marrow transplant.
I did a search, and he only had a couple of possible donors.
And one of the donors who went on the list trying to save someone she loved is given another chance to save a life.
I received a call from the hospital at Baylor saying that I might be a possible match for someone.
We did the typing, his donor was available, and she was a match.
The coordinator at Baylor looked at me and she said, "You're his only hope." And I knew then that there was nothing that was going to stop me.
When they called me with the news that they had found a donor, they found one person out of 4 or 5 million people. When I called my family up and told them, my brothers and sisters, that, I mean, it was just tears everywhere. We were just all a wreck, actually, you know, happy.
To be able to give someone that chance of hope that we had had for just a little while before Stan died was worth anything to me, to try it.
In Texas, Baylor physicians draw out Deidre's stem cells and prepare to courier them to Fox Chase Temple's transplant unit.
The courier came to take the material away, and I remember her saying, "How do you feel?" And I said, "You can't even imagine."
I'm starting your chemo.
For 7 days, Frank has additional chemotherapy to prepare his body for the transplant. Now, after 8 years of fighting, this is his last real hope of survival. Deidre's healthy stem cells are transfused into Frank through an IV.
The transplant that we chose to use was one of the newer forms of transplant where we use very low doses of chemotherapy. These are the so-called mini transplants. And the rationale there is to simply get enough chemo in to allow the donor cells to take. And then once the donor cells take, they will attack the lymphoma.
Now, the wait for the graft, the new stem cells to take over. For a long month, Frank is in isolation. His immune system has been destroyed, and until Deidre's can take over, he is completely vulnerable to infection. Anyone entering the room has to wear a mask. It is a difficult, lonely time.
I actually brought my fishing rod up and actually this hat. I would just cast in the trash can just for something to do because, you know, sitting in a room in isolation for 28 days, it gets a little monotonous.
A month after his transplant, Frank leaves the hospital, goes to his sister's to recuperate, and then home. Slowly, he builds up his stamina. Slowly, he begins to feel stronger, healthier. Often, he calls the transplant unit for support and help.
You can call them anytime, 24 hours a day, 7 days a week, 365 a year. Somebody will be there or somebody will return your call immediately. And that's why that's what's so important, to never feel alone.
To resist infection, Frank wears a mask, even when fishing. He's thrilled to be outdoors again.
I was just so happy to see like the seagulls flying overhead or the wind blowing the reeds. You know, I never noticed these things before. And you notice these things when you're that close to death, and the littlest things become important to you.
Over the next year, he often suffers bouts of graft versus host disease.
After his graft came in, I warned him that he would probably get some of the so-called graft versus host reaction, and he did. But fortunately, it wasn't the severe kind, and subsequently his disease melted away.
I was sick, but it was under control because my doctors kept a real close watch on it, and they adjusted the medication. As soon as one little thing would pop up, they're right on it, and they would adjust the medication, and in a day or two, I'd be back to where I was again.
From the very beginning, Frank feels deeply connected to his unknown donor, but neither will know the identity of the other until 1 year after the transplant.
I went to get a checkup at Baylor, and there was a letter from Frank, and it was an amazing feeling. The coordinator and I laughed and cried through the letter.
They write letters, and then Frank's coordinator asks if he wants to meet his donor.
I was calling her an hour later, you know, and we were on the phone, and we were talking, and laughing, and crying, and you know, it was just great to hear her voice, actually.
It was very moving to hear the gratitude in his voice.
Just 1 month later, Deidre and her fiancé Gordon come to Philadelphia and meet Frank at 30th Street Station.
I was waiting at the train station with a dozen roses and a big sign with her name on it because I had no idea what she looked like. Sort of felt kind of goofy with everybody looking at me, but hey, this is my donor. I would do anything for her.
I was anxious to meet him coming up the steps at the train station that day. He had told me what he was going to be wearing and all that.
Thank you so much. Thanks for everything.
Just to see him standing up, to see him whole, that was something I had dreamed for Stan. So to see Frank, well, was a wonderful gift.
Hey, this woman here just saved my life. Bone marrow transplant donor.
He could have come without the flowers, and I would have been glad to see him.
They become instant friends and keep in close touch. When Deidre and Gordon planned their wedding, they asked Frank to be an usher.
There were so many people, so many friends and family who had sent up prayers of gratitude and rooted for Frank the whole way. We wanted him to meet him. What a gift that he was there.
Frank has come a long way, but will doctors ever be able to use the word cure with him? We'll find out in a few minutes. And when we return, the story of a man in desperate need of a transplant, but unable to find a donor. Stay with us.
For more information about the Fox Chase Temple Bone Marrow Transplant Program, please call 1-800-TEMPLE-MED.
Jay Rohn had never been sick in his life, but as an athlete, he was used to pain. So when he was to 16,000 new cases diagnosed this year, Jay's wife Robin gets right on the internet to find out everything she can.
I just got on there and did as much research as possible. I researched the doctors, the hospitals, all of that. It was a tremendous help to us in figuring out, first of all, where to go and what questions to ask.
After thorough research, she and Jay choose Fox Chase Temple.
When Junius came in, he had severe back pain and anemia, both a product of this disease, multiple myeloma, which was growing in his bone marrow, crowding out the normal bone marrow elements and making it hard for him to make new blood.
How are you today?
To get the disease under control, Fox Chase Temple doctors first treat Jay with a combination of chemotherapies.
Any discomfort during
He needs the high doses to suppress his cancer, but the chemo is lethal to his bone marrow.
He wasn't really dying yet, but it would only have been a matter of months that he probably would have been dying from this disease.
His only choice is to risk a transplant. Months earlier, when doctors first began to discuss this possibility, they put him into the donor registry to try to find a match, as he had no brothers or sisters. The best hope for an unrelated match is from donors of the same ethnic background, but minority donors in the registry are few.
The problem with my bone marrow transplant, me being a minority, is the minority pool is very small. So I was basically told from the beginning that the chances of me finding a match were almost nil.
And in fact, months later, still no match. If he is to go through with the transplant, Jay will need to be his own donor, giving himself his own stem cells. But how can this work, since his marrow cells are cancerous?
What we're reinfusing back into the patient are primarily the benign, healthy bone marrow stem cells that are always left over in patients, even if there is some malignant disease in the bone marrow.
To urge his body to release a large number of stem cells into his bloodstream, Jay must give himself special injections. It is an arduous process. Finally, it's time to collect his cells, a process called apheresis.
I felt very apprehensive about what was going to take place. You're literally putting your life in the hands of the medical staff, the people who were there. And we trusted them. I mean, they made us trust them. They were wonderful people.
Jay's blood goes through a machine that collects his stem cells, then returns the rest of his blood to his body. The stem cells are then frozen and stored in preparation for transplant. It is a long and difficult day for Jay.
I remember having a laptop with me, and I was trying to watch a movie to take my mind off of it, but every time that machine, it kind of felt like a pump, and it would pump and it would pump, and I had my head in my wife's arms, and I was crying.
It was just trying to stay on the course and keep his mind on what the ultimate goal was.
Days later, the transplant. The team inserts a large needle filled with Jay's stem cells into a port and into his bloodstream.
They call it your birthday, a rebirth day. And this was a joyous time, because this is when my life started over again. This was the process of taking cancer and kicking it in the butt and saying, we're going to push you back and we're going to give you a chance.
But the period of isolation after the transplant feels terribly confining.
There were times when I get up in my bed and look out the window and look into the parking lot, and you see people coming and you see people going. You realize that the world is still going on. But at the same time, I knew I was getting better.
Getting better, but how much better? Were doctors able to collect enough healthy cells to suppress the cancer and bring Jay into remission? Stay with us.
For more information about the Fox Chase Temple Bone Marrow Transplant Program, please call 1-800-TEMPLE-MED.
After my bone marrow transplant, I came back a month later. I went from about 60 or 70% of my body being cancerous down to 4. So while that was a great triumph within itself, the cancer still exists. It's still there. It's still in me.
But now, 2.5 years later, Jay's transplanted marrow cells have been making the normal number of blood cells. Slowly, he's come back into the world and to some of the activities he loves.
I'm back to work. It feels good to be part of society again. I am limited in what I can do, but all things considered, I'll take it, because I'm here living and breathing.
This kind of therapy isn't a cure for this disease, but it's a very big hammer to hit it hard enough so that it stays under control for longer than would be the case if it was just treated with the conventional therapies that we have now.
Of all Jay's passions now, urging people to join the Bone Marrow Registry is one of his strongest.
When you are put in a position where your back is up against the wall, you want to have every tool available to you for you to be able to utilize. And by minorities not registering, that takes a tool away. That takes part of your hope away.
Frank and Deidre would certainly agree.
But I think I'm getting all this energy.
Because of me.
Actually, because I don't know how you thank somebody, actually, that, you know, goes to that much trouble and gives part of themselves to save you. Actually, just thinking about it now breaks me up. Love that woman. You know, love that woman.
And it was such a little thing. People say, you're my hero, or that was so terrific. And I think, why wouldn't you do it? Why wouldn't you do it?
It is now 4 years after his transplant. Frank is healthy. Deidre has come in from Dallas, and Frank takes her to the Bone Marrow Transplant unit to meet the staff. For the first time, Chris meets the woman she matched with Frank on the registry.
She and Frank truly are the perfect match, not only in blood and typing, but in personalities, and they were made for each other.
I'm in complete and full remission. And I just love those words, complete and full remission. Love it, you know, and hope to stay that way. You know, I want to prove to my doctors that they didn't waste their time on me.
I told him that if he makes it another year that I would be able to use the C word, which is cure, and I really mean it. We cannot detect his disease by all of the best scanning techniques. To be able to cure somebody, to literally pull him out of the fire and give them a whole new life, is just a thrill.
Once again, Frank is vigorously active, starting each day with a 10-mile bike ride.
I'm fishing whenever I want, as much as I want. I'm even back out surfing again. Can you imagine that? I didn't think I would ever be alive, let alone walking, talking, and surfing. You know, so, I mean, I'm back.
Although many cancers are curable when detected early, it is rare that doctors can use the word cure when speaking of advanced cancer. But bone marrow transplant can double or triple a patient's length of survival, and in a number of cases can offer a cure. And the earlier a cancer patient comes in for a transplant consult, the better the chance for that cure. This is a message of hope we rarely hear and sorely need. Now we all can be grateful it is within our reach. For Temple Lifelines, I'm Stephanie Stahl. Good night.
For more information about the Fox Chase Temple Bone Marrow Transplant Program, please call 1-800-TEMPLE-MED.